In the heart of Kamwenge, sub-county, a beacon of hope shone bright. 120 patients, mostly women, gathered for the medical camp like no other. The Lymphedema Warriors Association Uganda, in collaboration with the therapists from the UK and Australia, brought together a team of dedicated volunteers to provide education, support, and treatment. My dear friends, I'm honored to be part of this journey with all of you. As someone who has lived with lymphedema, I understand the struggles and challenges. But I also know that with the right care and support, we can manage this condition and live fulfilling lives. Our association is committed to providing education and support those affected. I shared different causes of lymphedema. We started with the genetic mutations, where I told patients these can be inherited conditions that can cause the lymphedema. We also have congenital. This can be present at birth. For some babies, they come out of their mom's womb and maybe one side is swollen, or they have a body part that is swollen. Due to abnormal lymphatic system development, a lymphedema can occur while you're still in your mom's womb. Then I also shared the removal of lymph nodes through surgeries. For example, those that go during cancer treatment end up having a lymphedema once the affected part where lymph nodes have been removed is affected. I also shared skin infections, where we have the bacterial infections like cellulitis can cause a lymphedema. We shared trauma. Those are injuries to the lymphatic system, and radiation therapy, where most cancer patients go through and damage the lymphatic tissue, leaving you with a lymphedema.
ati twaza kunaba ebaketi yitu itwagamba na rebafu.
The education sessions began with Jane Board from the UK, who taught patients about the skincare and the importance of maintaining cleanliness to avoid infections.
If any of you have swelling in your arms or your hands, the same procedure applies, that you would put your hand in the water and wash in the same way, but cleaning with a cloth between each finger thoroughly to make washed. You then dry the area that you have washed using, if you have a clean towel, and you pat yourself dry. You pat your foot dry and your leg.
Followed by Michelle from Australia, showed the patients how to stay fit and healthy with exercise especially designed for lymphedema patients to move the lymph.
Okay, we'll do deep breathing. So if I say take a deep breath, I want everyone to take a deep breath. Then we start our exercise. When we move our muscles, it helps push the fluid in our body. First exercise, tiptoes. And you can do it standing. And they can do that 20 times. Or 100. When you're cooking. If that's hard to do when you're standing, you can do it sitting as well.
okwemera kwakugumira nobasa kukora ekyo kushutama ekyo kyariyo nakora kore ekyo kyariyo nakora nakyo n'akatebe kawe n'omwana
Or you can go
nari n'omwana okorere
and move. Yes.
okay
And then the last thing that they need to do is actually spend time elevating their legs.
hariho
So-
ekindi ekikuru munonga okwimusa amaguru ekyariyo naboreka okwimusa amaguru mwakireeba
And move feet, wiggle feet.
orikutambuza ebigere
Rita Sarah from the UK demonstrated on how to use bandages and other different kinds of gametes.
byawe tubikwate
Yes. Today I'm going to demonstrate how to use the compression bandages.
ariyo nakubera ntuza kwega okubasa kukoresa ezibakweta compression bandages narezo za bandage ntuzimanyi
So I have some material here and of course I need a model. So the bandaging is going to be used for basically to move the lymph from the top of the body to the, from the bottom of the body to the top.
So ariyo bandage tuza kwega tuza kugikora aha muntu konka ekigenderwa ky'amaani kya bandage kyokora ngu amaizi gatambura kuruga ahansi
Yes, yes. So we use it as part of the management plan, like an option, like compression garment, hosiery, or bandaging. And then I'm going to show today how you can self-bandage yourself, basically.
okuti kukoresa ezi bandage n'okura ngu twageraho twayereberera mbwenu ogenda orayayizire kura ngu bandaging ni kimwe aha bintu kubasa kugira endwara mbwenu ariyo naza kwegyesa oku omuntu akubasa kukora kumwe haza tukyege oka nikikora.
Yeah, so then I'm demonstrating, but also very important, before the bandaging, you have to wash, like you use the skincare, like Jane showed before. So you basically wash the leg and dry very careful. And then if you have access to cream, so a good cream is very important.
Lastly, we had Elaine who took the patients through the self-manual lymphatic drainage massage.
Amazina ngu ni Elaine.
Loen has talked about the skincare, the exercise, the compression garment. With the lymphatic drainage, you've got lymph nodes in your neck, under your arms, in your groin, behind your knees. All over your body you've got pathways, but they're the main places, okay?
ariyo naza kugamba akubasa kujegena amiza agakuba aguturetera okuzimba haza twine engurikira ezomu twine zomu so nizariyo naza kugamba.
Okay, so in order for the swelling to go from your legs, we need to send it up, right? If it goes up here, then it'll drain away.
Amiza agawa kutuzimbya amaguru bine kora ngu twaguma tugasikanigisha kuno ruguru gashika kuno ruguru nibwo gakugira kigakubasa mwenu kura kugagegena kubasa kubwihanga.
Do your legs, when they're swollen, feel heavy?
Amaguru gitu kugakuzimba garemera.
This is going to help them feel a lot lighter.
So ekyo kyari naza kukora nikiyamba kora nkura kuguru kuba nukuremera kwahwerwaho kwachendeza uburemezi.
After education sessions, each patient had the opportunity to have a one-on-one talk with the therapists where they were counseled, they received personalized attention, treatment, and were provided with medical supplies to take home. The medical camp was a huge success thanks to the dedication and generosity of our volunteers and partners. We hope that the knowledge and support provided will empower these patients to take control of their condition and live better lives. The Lymphedema Warriors Association Uganda is committed to continuing to provide support and education to those affected by lymphedema. Together we can make a difference.